Hi, welcome to Healthy Conversations. I'm Courtney Brimm. I'm a speech-language pathologist at YRMC. And today I'm going to talk to you about swallowing, and in particular, the changes in swallowing that occur just with age, some of the normal changes that we encounter with age, and things to consider as the swallowing starts to change. Okay. So throughout this presentation, first we're going to take a look at swallowing and just get a basic understanding of what's happening when we swallow. And from there, we'll sort of identify and break it into 3 different phases of swallowing. It's very, very oversimplified. So swallowing is a very complex process that involves about 50 muscles, lots of nerves, cartilages, and structures, all working together to make that swallow happen. But in the interest of time and simplicity, we'll just break it into 3 phases for today. We'll talk about recognizing some of the signs of a swallowing disorder that is more serious than those symptoms that arise with aging. And we'll look at some things that you can do to try to prevent some of the negative outcomes of those symptoms and keep eating and drinking as comfortably and efficiently as you can. And then, of course, what to do if you suspect a disorder. Okay. So what happens when we swallow? Again, we're simplifying it into 3 phases. On this image here, you can see just the side view of the anatomy involved in swallowing. Don't worry too much about the names of the different structures here. I just wanted something to be able to illustrate what is happening and where the food goes and where the air is going when we're eating and swallowing and breathing. So the first phase, just the oral phase, this is the mouth. Essentially, it's the tongue, the lips, and the teeth all working together to, hold on to the food and liquid and prepare it, chew it, and get it ready to swallow, okay? And the tongue and everything, it works to move the food and liquid back towards the back of the mouth that then triggers a reflex. And that reflex begins the next phase of the swallowing, which is the pharyngeal phase. The pharynx is your throat, okay? So it's essentially this whole area in here is your pharynx. The pharyngeal phase is most important because it's protecting your lungs. It's protecting your airway at the moment of the swallow. All of the lining, all of the soft tissue of the throat and the tongue, there is, it's just a lot of muscle contraction, all working very swiftly to propel the food and liquid through the throat while simultaneously pulling this here. This is your airway. This is your larynx and your trachea down to your lungs. But there's a series of muscle contractions that work to essentially pull this structure up and forward. And that is what opens the esophagus at the moment of the swallow. Okay. It's very complex, lots of things happening all at one moment. And when everything goes as planned, that pharyngeal phase moves everything, the food and liquid, through the throat and into the esophagus, which you see here is really lying flat and closed until the moment of when it's opened at that moment of swallowing, when everything gets to pass through. Okay. So first we're going to just talk about presbyphasia. This is the term that refers to those changes in swallowing that occur with age. Okay. Most often it's just anatomy or physiology changes that are very normal and in generally healthy older adults. It does, however, contribute to a loss of functional reserve, making it harder for the body to fight off infection or to heal from illness or injury. Okay, so just because it's normal swallowing changes doesn't mean that it's without risk. Okay. Also, the presbyphagia, this aging swallow and those changes from age, can also have a negative impact on quality of life and independence. as, just the act of eating and drinking becomes a little bit more challenging and taking more effort and time, and just it's not as easy as it used to be. So, all right. And now we'll compare that to dysphagia. Okay. Dysphagia refers to that swallowing problem, a disordered swallow. Okay. Dysphagia is a growing concern. It's affecting around 22% of adults over the age of 50. And generally it results as a symptom related to either damage or illness affecting the brain, the lungs, the gastrointestinal system, digestive system, and even, the mouth and oral structures, such as things like mouth cancer, throat cancer, okay? Dysphagia also, however, can result as a side effect of medications. So that's something that is often overlooked, but it comes up quite often. And unfortunately, dysphagia is linked to malnutrition, dehydration, aspiration pneumonia, and an overall reduced quality of life, as sharing meals with family or having coffee with friends just become things that we're not able to do anymore. So dysphagia is treated often with speech therapy. And we work in speech therapy on both compensating for any disorder that may be present, or rehabilitating whenever we can, try to get that function back. All right, so looking first at the oral phase and what happens with presbyphagia, that aging swallow, right? People with presbyphagia tend to take longer to chew. Oftentimes this is due to, changes in our dental status. Maybe we have missing teeth or our dentures are poorly fitted, and that can make it very complicated and difficult to chew and manage the food in the mouth. There's that swallow reflex that occurs as the food is moving toward the back of the mouth. Oftentimes that reflex is just a little bit slower to fire, and so people might notice that they're holding the food in their mouth a little longer, waiting for that moment of the swallow to really occur. People with presbyphagia may have reduced taste and smell, things just not quite as enjoyable as well. That just, we get a lot from our food as far as the enjoyment of it goes, from the smell and the taste of it. So that starts to reduce as well. We also might have some mild residue in the mouth after we swallow, and just meaning usually it's not too serious. A sip of water can help wash it down. But all of that extra, maybe sips of water or the extra work of chewing and managing the food in the mouth does lead to reduced endurance. It's taken a lot more energy to get through meals now. Okay. And now looking at the more serious symptoms of dysphagia that affect the mouth or that oral phase of swallowing. Dysphagia usually results in extremely long meal times. That reflex to kick off the swallow is sometimes significantly delayed, perhaps even absent altogether. People may have no taste or smell, which really impacts the swallow by reducing what kind of signals and how much information the brain is receiving about what's happening in our mouth, making it even harder to really coordinate all of the events of the swallow. Poor containment and control. This can show up as either food or liquid escaping from our lips as we're trying to chew or drink liquids. We might lose it out of the mouth, but on the other hand, it can also go the other direction and result in food or liquid falling toward the back of the throat before the system is ready for it. Oftentimes people with dysphagia will have moderate, if not severe, residue in the mouth, oftentimes perhaps food or liquid, or primarily food, pocketing and getting stuck there in the between the gums and the cheek. So, okay. Now looking at the pharyngeal phase, the throat, somebody with presbyphagia, generally, they might choke on saliva once in a while, but it's not all the time. They might have an occasional cough while they're eating and drinking. Usually that's due to distractions. The slower transit time, meaning it's just taking a little bit longer for the food to be propelled through the throat with those muscle contractions coming together. They're just moving a little slower than they used to, so it takes a little longer. Again, that sort of feeds into the reduced endurance. As we age, we lose muscle mass, and that takes away from our speed and strength associated with all those muscles in the pharynx. Okay, and we also might have a little bit of residue in the throat after the swallow. With dysphagia, somebody usually experiences a lot of coughing or choking. Maybe their voice is often wet sounding, and this is a red flag letting us know it's a good chance somebody's perhaps aspirating, meaning that food and liquid is going down the wrong direction and going into the airway instead of the esophagus. People with dysphagia often have a weak or an absent cough, which means they're not able to effectively clear anything out of the lungs with that cough response to clear anything out that might have been aspirated. They might have insufficient endurance or strength during the meal to get through the meal. And they'll have a lot more residue in the throat just due to the muscle weakness or just maybe things not moving as they should. Okay, people often complain of feeling something stuck in their throat as well. Okay. All right, now moving on to the esophageal phase. This is the esophagus. With presbyphagia, people tend to eat less and drink less just because they feel full sooner. 90% of folks over the age of 65 experience slower movement through the esophagus and slower emptying into the stomach from the esophagus. And so they just tend to feel full, and so they'll eat less and less. Okay. With dysphagia, affecting the esophagus, people will often avoid eating and drinking due to the discomfort or just the effort and overall just not feeling well, or perhaps vomiting as well. This leads to weight loss, dehydration, malnutrition, and importantly, dehydration is often related to urinary tract infections too that can be very, very dangerous in the elderly population. So a few things that we can do for presbyphagia, the aging swallow. Really kind of simple stuff that you can do at home, just reducing distractions. Sitting upright, making sure you're in a chair at a table versus reclined in a lazy boy or even laying down in bed or something. That's just going to make it easier on the lungs and the whole system to coordinate breathing and swallowing. Eat and drink deliberately. Really put your attention on the fact that you are swallowing, you are eating and drinking at this time, and try not to be doing too many things at once. Okay, the thing that used to be a very reflexive activity is now requiring more attention. Chew thoroughly, and of course, consider the denture fit or other dental issues that might be interfering with your ability to safely chew and properly prepare food and liquid for swallowing. Okay. Oral care is one of the best things that you can do to prevent infection. It is just brushing your teeth, or if you wear dentures, making sure that you're still continuing to keep your mouth clean. Taking the time to use a soft bristled brush and brush your gums, keep the mouth very clean, even if you don't even if you don't have any teeth and you don't think that you need to do it. Still, it's a good idea. Be aware of that low appetite and lack of thirst. We generally will start to not have that sensation of hunger and thirst like we used to. And if we don't feel hungry, we generally won't eat, but that will very easily lead to malnutrition, dehydration, and other issues that it can just sort of snowball from there. And if you're experiencing any of these symptoms that I've mentioned today, or other symptoms, this certainly was not an exhaustive list of symptoms for swallowing disorders, contact your physician and ask about getting orders or a prescription for a swallowing evaluation. Okay, we can do a clinical swallow evaluation or a modified barium swallow evaluation. Those are the two tests that we offer through Yavapai Regional Medical Center. Okay. But more importantly still, I just want to drive home, sorry about that. Just don't ignore your symptoms, okay? Even the more mild symptoms associated with presbyphagia and aging, if they are left ignored or just we're not really paying attention to them, they can easily set us up for more problems and even developing more of a dysphagia situation through malnutrition and dehydration. Okay, now it's time for some questions. Bridget, do we have any questions?
We sure do. The first question is from Barb, and she asks, does the fact that I have a hard time taking pills mean that I have a swallowing problem?
Well, it could. I mean, certainly you're having a hard time swallowing pills, so that's a problem. But there are many people who experience difficulty taking pills that are otherwise, they don't have a problem with food or liquid, but it's just getting those pills down. So it could be an indication that you have a swallowing problem, but really I would just recommend getting orders for a swallow evaluation, and we can see why that problem with swallowing the pills is occurring. One thing that tends to help people very easily, and it's pretty safe to try at home, but you may just want to wait and do it with a speech-language pathologist. But a strategy that we use often is taking the pill with a spoonful of applesauce or yogurt or pudding, something that's a little heavier that can take that pill and just carry it down through the swallow versus everything having to coordinate around that small pill or capsule.
We have a question from Todd. He says his father had a feeding tube when he was in the hospital, and he wanted to know if swallowing therapy would help his father recover from that.
Quite possibly. Of course, that would depend on why he has the feeding tube in place and what the medical condition is overall. It is very common that patients might be in the hospital and have a feeding tube placed to get through the acute phase of an illness. And very oftentimes then they are seen for dysphagia therapy afterward. And we can have a lot of success. But it would just depend on your father's condition and everything else going on. So I would recommend getting in order for an evaluation and see if there's something that can be done for him.
And Laura wants to know what a swallowing evaluation would entail.
Okay, the clinical swallow evaluation is when a speech-language pathologist evaluates the patient to look at the function of the sensory system and also the motor function associated with swallowing. So oftentimes it's having you do different things with your mouth and face to make sure that you can control the muscles adequately. We may stimulate the different parts of the mouth or face to check your sensation and see if you're receiving that sensory input. And then from there, oftentimes we go into actual trials with food and liquid to see just, how you manage it, how well, if it's primarily in the mouth where the problem's occurring, that's something that we can easily see just in the clinic without any imaging done. However, when it comes to concerns related to the pharynx or, of course, the esophagus, the pharynx we would evaluate with a modified barium swallow study. And that's done by the patient eating and drinking barium contrast under fluoroscopy. And those are, the images are recorded. The speech pathologist reviews those images in collaboration with the radiologist to evaluate the anatomy and the physiology of the swallow and try to find out exactly where the breakdown in the swallow is occurring. And then from there, we're able to really develop very specific treatment targets or exercises or compensations if that's what's necessary.
We have a really interesting question from Kyle. He would like to know what kind of exercises can be done to strengthen your swallowing.
Yeah. Swallowing exercises are much different than what we think of when we think of exercises, because there's nothing external that we can really hold on to and move and feel that exercise as if, say, we're lifting weights. However, we do follow the same exercise principles that apply to any other muscle group of the body. So One of the most common exercises for swallowing is what we call the effortful swallow. And this is essentially where we teach you to really tune in and be aware and be able to feel the different structures of your swallow through the oral phase and the pharyngeal phase, and trying to just build your ability to hold those muscle contractions longer. And thus, with repetition, like any other exercise, we're building some strength. But of course, strength also requires some sort of resistance, lifting a heavier weight to get stronger and stronger. So resistance in swallowing exercises generally is provided through thicker or heavier consistencies or textures of food. So something like pudding would be considered heavier than something like water, just the way that the muscles have to contract to move that through. Yeah.
Okay. We had a question come in from Sheila, and she suffers from acid reflux and wondered if that can cause swallowing problems that she's been experiencing.
Absolutely. Although reflux is really a gastrointestinal problem, and that's not something that a speech-language pathologist diagnoses or treats as far as correcting the problem. Reflux from the stomach, stomach acid refluxing into the esophagus, and then from the esophagus, sometimes refluxing up into the throat, come up very often in the speech therapy. We treat a lot of people where reflux is at least part of the patient's problems. It can very often be that somebody feels that food or liquid, they feel something sticking in their throat, but then you get under the fluoroscopy and you see actually the problem is far lower. But remarkably, we sense it up higher. So reflux is certainly a big contributor to dysphagia symptoms. So.
Okay, and Mike has a question. He was interested in the information that you had regarding the kind of conditions that can bring on a swallowing disorder. Are there any more specifics you can give on that?
Yeah, dysphagia and swallowing disorders arise as, again, they're the symptom of some other problem. And most commonly, those conditions in our setting anyways, in the hospital or the outpatient clinic, most often we are treating people who have had a stroke. Many people with Parkinson's experience swallowing difficulty. Those are very, very common. In the hospital setting, in the acute care setting, people are often seen for swallowing impairments due to just the acuity of their illness itself affecting their cognition. And cognition or even dementia, that also lends itself to swallowing disorders, where somebody may just not be able to maintain that awareness and the attention to the swallow to really execute it safely, really. So, but there are a lot of conditions that can lead, but those are most common.
Excuse me. Tara wants to know, is it only the elderly that are affected by swallowing disorders?
No, it is, when we're talking about presbyphagia, that is specifically related to aging and the changes in swallowing associated with aging. But dysphagia, or a swallowing disorder, affects people of all ages, from infancy through adulthood. Yeah. So.
And you've already mentioned this, Courtney, but Bob wanted to know about needing a doctor for a referral to a speech-language pathologist. Can they make appointment directly with an SLP, or do they need to go to their doctor first?
Through Yavapai Regional Medical Center, we do require a physician's order because we're treating everything as how is this affecting your overall health, and that's in collaboration with your medical provider. However, in a private practice setting, it may be a different story. So if somebody's perhaps just wanting to just get some therapy and they don't want to go the doctor route, they could try contacting a private practice. But as far as here at Yavapai Regional, and in general, it's normally through a physician's order. So
this is our last question. This is from Joseph, and he said that, again, this is something you mentioned, but it doesn't hurt to reiterate. He heard that liquids that are thickened can help with swallowing issues. And he just wanted to know a little bit more about that for his mother who's having problems.
Yeah. Well, the thickened liquids are certainly an option. They tend to slow down what it is that we're swallowing. So there's different thickening agents and products that you can purchase that you add to food or liquid to just change the consistency and the texture of it. For some people, that's really helpful because maybe the swallowing system's not able to move fast enough to really manage the rapid movement of, say, water, how it goes really fast and it's hard to manage for some folks. So it's helpful in the respect of it slowing it down. I would caution you, however, on just starting using thickened liquids without having consulted a speech pathologist and having a swallow evaluation done, because thickened liquids, while they can be helpful for some things, it's certainly a trade-off. One of the bigger concerns with thickened liquids is dehydration. People tend to drink less fluids when they're thicker. And so then we're it's certainly a trade-off, and it's something that if you need it, great. If it's what is best for you, great. But let's verify that with a modified barium swallow study and really ensure that it is in fact the best thing for you. There are times when people may cough when they're drinking water and they thicken it and they'll take a drink, but they don't cough. And we might think, oh, okay, problem's fixed. We fixed it. But research has shown that those folks who don't cough with the thicker liquid, there's still a good chunk of those people that are still aspirating, but we're not sensing it and having that cough response. So you really want to verify this through imaging. So it's a trade-off. So it helps some people, but you don't want to just jump to it.
And that's all the questions we have today.
Okay. Well, thank you.